Hello, my name is Julia Ford. I will be talking about the benefits of flossing today. So I just wanted to start out this presentation with a question for all of you. So do you believe that flossing once each day is more dreadful than being in the dental chair for hours trying to restore your teeth or even get an extraction? So today I will be sharing how flossing can have many benefits and not just protect your smile, but it can protect your overall health. And I have been a dental assistant for over 2 years now, so I have seen firsthand of the benefits of flossing, what flossing, the lack of flossing can do to a patient, their oral health, and their overall health. So flossing is a low risk, high reward habit that saves individuals from severe and costly dental issues. So I will be going over 3 points today of how flossing can reduce the risk of cavities, combat gum disease, and remove plaque and prevent plaque buildup. All right, let's get into the first point, which is reduce risk of cavity. So floss cleans the hard to reach places. So a toothbrush cannot effectively clean all the surfaces of the teeth. It usually covers the surfaces that we can see, but we are missing 2 surfaces of the teeth, which is in between each tooth. This is where flossing comes in. This is where it benefits from. So flossing cleans in between those areas that we do miss while brushing. Flossing prevents bacterial growth of cavities. So bacterial growth comes from food debris and turns into plaque. So for example, when you eat a donut and get a coffee in the morning and then fast forward to dinner time, you're gonna feel like this film on your teeth. That is called plaque. And I have a quote. This article is called, "Does flossing your teeth prevent tooth decay?" And it starts with, "These bacteria eventually begin to break down the tooth surface, leading to painful cavities that need fillings, or even the removal of a tooth if the decay is too widespread." And this is made by Claudie Hammond in 2014. So not only does flossing keep your teeth from getting cavities, it also combats gum disease. So flossing reduces inflammation by removing irritants. So the plaque that I was talking about, it's like a sticky biofilm of food particles and bacteria. It's like a mix of both. And this plaque irritates the gums, leading to gingivitis, which I'm sure everyone has heard of. This is inflammation of your gums, which leads to bleeding. So after a cleaning from your hygienist, you might have a whole mouth of blood. Or even if you're just trying to floss after a while, you will see blood. That is gingivitis. It is reversible, however. So if you just keep flossing, the bleeding will go away. So flossing supports overall gum health. Healthy gums, when they're maintained, they are firm and pink. Swollen gums are red and swollen. All right, so I have another quote, and the article is called, "Ask the expert, do I really need to floss?" And it goes, "If the plaque stays in one place for a long time, it can cause periodontitis, an inflammatory condition in which the gums pull away from the teeth. If not treated, the bones, gums, and tissue that support the teeth are destroyed." And this is by Jennifer Siricki in 2019. All right, so flossing combats gum disease. Let's move on to removes plaque and prevents plaque buildup. So floss removes plaque buildup before it hardens. This is called tartar. And tartar is a rough, hardened mineral left behind if not removed. So after a while, if you haven't flossed in a while, you're gonna grow tartar. Another quote by Breaking News, "Flossing prevents tartar buildup." It says, "If you do not floss and then brush efficiently and consistently, the plaque hardens and forms tartar." And this is Inception 1 in 2021. So flossing daily avoids professional cleanings of plaque buildup. So like I said, tartar cannot be removed. It will with brushing or flossing. It requires dental tools such as a scaler or a Cavitron tip, and it is very painful. It's like picking a scab. You do want to avoid it. And I have another quote, by removing plaque and tartar from teeth. I picked this one because it shows how to avoid this. So flossing first will remove pieces of food and plaque from between the teeth to hard to reach areas. After flossing, the toothbrush will remove plaque on the surfaces of the teeth. And this is by Christine Frank in 2024. So in conclusion, over the past few minutes, I talked to you about how flossing can reduce cavities, combat gum disease, and remove plaque from plaque buildup. So the next time you reach for that floss, you're not just cleaning your teeth, you are protecting your overall health. Thank you for listening.